In 1982, Lee Thompson's documentary, DTP Vaccine Roulette, was released during a time of public mistrust in the government, resulting in intense media coverage, fear among American parents, and litigation against manufacturers. This spurred the creation of parental anti-vaccine groups such as the National Vaccine Information Center. Long-fought diplomacy between concerned parents, the American Academy of Pediatrics, and Congress led to the creation of the first American Vaccine Injury Compensation Program. Efforts by these parental organizations were corrupted by misinformation and inspired many other anti-vaccine groups, creating the modern anti-vaccine movement. The vaccine debate stemming from this movement has resulted in substantial vaccine hesitancy in the United States and the alteration of what is fact in the media. In 1796, the first modern vaccine was made by Edward Jenner to combat smallpox. Immediately, there was opposition that was expressed through protests, propaganda, and the creation of anti-vaccine leagues. A fear of the contents of vaccines and possible adverse effects were at the core of anti-vaccine attitudes and resistance. The original anti-vaccine movement was allowed to grow for the next 100 years until scientific advancement in the 1930s helped dispel many of these common qualms about vaccines. With the creation of potent vaccines for measles, polio, diphtheria, tetanus, and pertussis, there was a large-scale decrease in infectious disease. Societal confidence in vaccines did significant damage to the momentum of anti-vaccine sentiment. This was echoed when the first national vaccine program was created with the Vaccine Assistance Act of 1962. With this government regulation, vaccination had become a normal part of American life. Through the 1960s and 70s, public trust in American government authority was weakened due to events such as Watergate and the Vietnam War. In 1976, this distrust turned to the medical industry when reports surfaced of swine flu vaccine recipients developing Guillain-Barré syndrome. At this time, reports also increased of children who took the diphtheria, tetanus, pertussis vaccines in Britain receiving brain damage. Negative media attention led to a dramatic decrease in DTP vaccination, and a pertussis epidemic swept across Britain. In 1978, the idea that there was a quantifiable danger to the vaccine was reinforced further after a study reported brain and central nervous system damage in a few people. Although widely referenced, the study was criticized by some, claiming it neglected other causes for the adverse events after vaccination. Only after an aggressive public relations campaign were the vaccination rates stabilized and the incidence of pertussis lowered. As the pertussis controversy in Britain came to a close, rhetoric against the DTP vaccine crossed the seas into America. A large surge in reporting of adverse events after receiving the DTP vaccine followed. In 1981, acclaimed NBC News reporter Lee Thompson decided to launch an investigation into the subject. Throughout her investigation, she aimed at exposing the danger and ineffectiveness of the vaccine that had been referred to as a witch's brew, dirty, crude, and medieval. In 1982, Lee Thompson released her findings in the controversial documentary DTP Vaccine Roulette. It was nationally aired 3 times, causing media coverage across the nation to focus on the possible dangers of the DTP vaccine. The documentary also caused a major increase in lawsuits filed against pharmaceutical companies, claiming damages in the millions for faulty vaccines. All manufacturers except Letterly Laboratories ended production of the DTP vaccine due to fear of litigation and bad media coverage. The documentary was heavily criticized for its failure to properly portray the dangers of the diseases the vaccine fought, and was accused of misinforming the public about the danger of the vaccine. Out of the chaos produced by the documentary, a collective of parents with vaccine-injured children formed the organization Dissatisfied Parents Together. This organization used congressional connections such as Florida Congressman Dan Mica, whose vaccine-injured kids were pictured in vaccine roulette, to get reformative legislation introduced. The basis language for this legislation, first introduced in 1983, was written by the American Academy of Pediatrics in conjunction with Dissatisfied Parents Together. Senator Paula Hawkins and Representative Henry Waxman brought the bill to Congress, which acted as a diplomatic olive branch between concerned parents, vaccine manufacturers, and the American public health system. The act's purpose was to ensure childhood vaccine safety and create a streamlined litigation process for those injured by vaccines. The former would be done through a new and reformed national vaccination program, and the latter with a vaccine injury compensation program. The bill was rejected and reintroduced twice until 1985, when a vaccine shortage was looming on the nation, forcing Congress to pass the National Childhood Vaccination Act of 1986. This act effectively ended the initial controversy caused by the release of vaccine roulette. The National Vaccine Injury Compensation Program was the first of its kind in the United States. The program made the government liable for vaccine damage instead of private manufacturers, giving vaccine producers legal immunity from vaccine damages and allowing vaccine prices and production to stabilize. Along with the novel program, a new, safer, but less potent pertussis vaccine entered circulation. After their initial success with childhood vaccination reform, Dissatisfied Parents Together rebranded as the National Vaccine Information Center, or NVIC. In the late 1990s, the NVIC became involved in the movement to enlighten parents to the believed correlation between vaccines and autism. In 1999, NVIC founder Barbara Loe Fisher requested a Freedom of Information Act on the levels of mercury in thimerosal, which is a common vaccine component that has been touted to cause autism despite no reputable research proving it. This information created fear among American parents and prompted a joint statement by the American Academy of Pediatrics and the U.S. Public Health Service calling for thimerosal to be removed from vaccines. The vaccine autism movement continuously gained momentum through moments like this and endorsements by celebrities such as Jenny McCarthy, Robert De Niro, and Jim Carrey. Efforts by the medical community to curb this movement and end the vaccine autism debate have included issuing many statements denying the correlation and engaging in public health information campaigns. Many of these attempts have failed to convince hesitant parents fearing for the safety of their child, leading to a decrease in vaccine confidence throughout the nation and historic lows in measles vaccination. With this lack of vaccine coverage, there have been many preventable deaths and injuries from a disease marked as eliminated by the World Health Organization in 2001. The NVIC's most recent exploits have involved creating mistrust in the COVID-19 vaccine. In November 2021, during their annual conference on vaccine information, a recording was leaked by the Center for Countering Digital Hate, showing the NVIC formulating plans to cause distrust against the use of the COVID-19 vaccine. The actions of the NVIC and the scores of anti-vaccine groups inspired by them have had an immense impact on the state of the COVID-19 pandemic, with only 60.5% of the U.S. being vaccinated. Although some of the 39.5% have medical or religious exemptions, many are unvaccinated due to a hesitancy based on misinformation provided by the anti-vaccine movement. The intellectual space created by the NVIC has changed the face of the vaccine debate. The pertussis vaccine controversy and the movements that grew out of it eroded an already weakened trust between many patients and their physicians. This lack of trust has been exploited by anti-vaccine groups such as the NVIC by using misinformation and other tactics to elicit fear. The presence of blatant misinformation has shifted the vaccine debate away from science and to something more subjective. A voice was given to scientific laypeople wanting a say in what went into their body, but there has been a substantial failure in using that voice morally and accurately. The vaccine hesitancy cultivated by the anti-vaccine movement has led the World Health Organization to deem vaccine hesitancy as one of the top 10 threats to humanity. Although reform in the vaccine program is noticeable, the consequences of the anti-vaccine movement and the needless death caused by it overshadow any successes in the vaccine debate.